Well, good morning to everybody.
Good morning.
It's just so good to have you here with us on today, and it's just my pleasure and honor to be able to talk to you a little while today about oral anatomy. That's the primary talk that we want to have, but more importantly, what I always do to our first year dental students, the very first day of class, I put a word on the board. This is the most important word in your life. What's that say?
Truth.
Those of you who are Bible scholars, the Bible says, "Thou shalt know the truth," and
The truth will set you free.
huh?
The truth will set you free.
Well, we ain't got no Bible scholars in here. No, that is not what it says. It says, "Thou shalt know the truth, and the truth shall make you free.
That's right.
And whom the Son sets free
Shall be free.
is free indeed." So we got to tell the truth. And then the second word that I put on the board is why. Why? Why do you need to know the truth? Because it will make you, not set you free, it will make you free. It will make you free. Thou shalt know the truth, and the truth shall do what?
Make you free.
Make you free. What is that? Say what? A cube? What do you say it is? Yeah, you
Oh, I think it's a cube too.
Oh, okay. What did you say it is? What about you?
Cube.
Yeah. So because they said a cube, you gonna say it too. They gonna jump off the bridge, gonna jump off too. Just because they said it. What is it?
Cube.
Tell the truth.
A shape.
Tell the truth. Tell the truth. Tell the truth. It ain't nothing but some black marks on the board.
Okay.
That's all it is. Ain't no damn cube. Ain't none of that. It's not any of that. Tell the truth. Tell the truth. Okay? What's your question? What do teeth do?
What do what do?
What breed do?
They'll be digest food.
Break down food? What? Anybody? What do you say, young man?
They help you digest your food.
Help you digest your food. Young lady right here. Well, what do you say? What does he do?
It helps you chew your food.
Helps you chew your food. Okay, yeah, come on. Tell me that.
They keep like the structure on your face.
But what did you say it is?
They sit in your mouth. They sit in your mouth.
Sit in your mouth. They sit in your mouth. They sit in your mouth. What about the young lady with the headphones on right there? Come on, talk to me.
You can pass it on to another student.
Oh, no, can't pass the buck. No, not in my class. What did he do?
They help nourish your body.
Help nourish your body. Okay. What did he do?
They stay in your mouth to smile.
They smile in your mouth. Okay.
And they just eat. They organize. They are organized.
They're organ.
Man,
Yeah.
I learned that yesterday.
There was only one word that was correct out of all of that you said. That word was
Breakdown. Yeah.
no, teeth don't chew food. No, they don't. Teeth don't have any muscles. They can't do that. Teeth don't taste food. They don't have any taste buds. No, teeth don't do that. Teeth don't give you a beautiful smile. No, just think about a brand new baby. And you take that brand new baby and tickle him on his belly, and he got the biggest smile and not one tooth in his head. He just as cute as he can be. No, you don't need teeth for that. You don't need teeth to chew your food. Matter of fact, you can eat without teeth. You can. You can take all your food, put it in a blender, and then drink it. But think about if you had a big, red, delicious apple. Now let's think about that. And you anticipate on taking a bite of that apple. And as the apple is drawn closer to your mouth will drop. You don't even have to think about it, it'll do it. And that apple will go in there. And then you'll hook those teeth in the apple. Did the teeth hook in the apple? No, your muscles move the mandible to make it do that. And then think about it. As you close your mandible, you can hear that those teeth penetrating that apple. And just before your teeth touch, a reflex will go back from your muscles to your brain, back to your arm, and you will tear that apple away. And you got that apple in your oral cavity. And the next thing that you're going to do is going to drop that mandible. And with your tongue, you're going to set that piece of apple on your favorite side that you like to chew on. And you're going to close. And think about all of that good juice that spurts into your mouth. Just thinking about it, you start salivating.
Yeah.
Am I right? You can do that without teeth, but it's a lot easier if you had them. So teeth help you to chew. Teeth help you to have your facial form to support the face. Teeth help you to do that. Teeth also help you to talk. Everybody say this, that, them, those. If you didn't have teeth, you would say this, that, them, and those. Everybody say Mississippi.
Mississippi.
You hear that S sound? Mississippi. Mississippi. If you didn't have teeth, you would say Mississippi. Everybody say very fine.
Very fine.
If you didn't have teeth, you would say very fine. So teeth help. In other words, what teeth do is improve your quality of life, make life a lot better. It enhances the enjoyment and pleasure that you get out of life. So are teeth necessary?
Yes.
No.
They're helping to.
Yes.
These are not necessary.
They're not necessary for life. They're not necessary for life. They're not. But they sure make life so much better. Can I get a witness?
Amen.
So today, what we're going to talk about is, if I can do this thing right, we want to talk about oral anatomy. And our objective today is just to kind of describe what the oral anatomy is like. And we want to give an introduction to nomenclature about the mouth. And we want to understand the anatomic features that correlate to the susceptibility of tooth decay, known as dental caries. Known as dental caries. So let's think about the face. Guess what? All of them, all of us have it. Okay? Now, let me see. Let's see right here. Okay. Young lady right there with the blue. Yeah, you right there. Yeah, uh-huh. 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 Let me see you touch your right ear with your left hand. Are you sure that's your right ear? What makes you so sure? Have you ever seen your right ear? Okay, let's do it again. That's hard. That's hard. That's hard. Touch your forehead right there. Have you ever seen it? All right, now let's tell the truth.
No, you haven't.
No, you have not ever seen it. You've seen it in the mirror. You've seen a picture of it, but you've never seen it. You've never seen your chin. You've never seen it. But how do you know it's there? That phenomenon is called proprioception. Proprioception is the nervous sensation that allows you to know where your body parts are. If I told you to touch the top of center of your head, you can do that. And you've never seen it before. You don't know it. Touch that little knot in the back of your head. You know it's there, but you've never seen it. You've never seen it. Proprioception allows you to know where your body parts are without even seeing it. Let's see. Young man right there with the green on.
Yeah.
How many eyes do you have?
2.
Are you sure?
No.
Okay. Huh?
Yes. Yes, I have 2. Yes, I have 2.
Hey, John, funny.
Yes,
Are you sure?
Yes, sure.
Right beside you, right there, young man. How many you got?
Huh?
How many eyes you got?
2?
How you know?
Because I'm looking through
Have you ever seen it?
them. No.
No, you've never seen your own eyes. You've seen images of it, and you are human, so therefore you have deductive reasoning. Since in the image that you saw, you say you think you saw 2. So therefore your answer was 2. Okay, now watch this. What's your name? The green shirt.
My name's Colton.
Colton.
Colton. Yeah, Colton.
Colton. Okay, Colton, close your eyes. Touch your nose. Rub the nose. Can't you picture in your mind what that nose looked like?
No.
And you've not seen it? Oh, yes, you can. Can't you picture how your ear looks and you have not seen it? So therefore, you have 3 eyes.
I say 2 things when I see this.
There are 3 of them. You got these 2, Kobe, plus you have one in here called your mind's eye. Kobe, close your eyes and picture a bag of pop. Can't you see it?
Yeah.
You can see it.
Yeah.
It's in here.
Yeah.
It's in your mind's eye. So therefore, you can't trust those 2 eyes in front of your head, because those 2 eyes will deceive you. That's how the magicians do their magic. They deceive the naked eye, and you think they made a rabbit appear out of a hat because your eyes are lie to you.
What is that?
Holden,
Yeah. Yes.
give me a name of one of your classmates.
D'Angelo.
Where's D'Angelo at? What they say, D'Angelo? Okay. All right, D'Angelo, I told you just now, don't believe your lying eyes. Don't believe, you say that says, oh, let's read it slow, D'Angelo. All,
The family.
huh?
Like, why is he writing on the?
You see how those eyes are lie to you?
Yep.
So that means that you have to see what you really see. So we as dentists pay close attention to detail, keeping in the back of our mind that our eyes could deceive us. Our eyes could be deceiving. So when we look at the face, and you have one, you can look at it in the mirror when you get home or back to the dorm. We can divide the face into three component parts. From the eyebrows to the hairline is the upper third of the face. From the eyebrows to the base of the nose is the middle third of the face. And from the eyebrows to the lower chin is the lower third of the face. So which third of the face will you find the mouth?
The third.
It's in the lower third of the face. That's where we'll find the mouth. But you can also look at an individual and divide the face longitudinally into fifths. So right here at the nose is the middle fifth. And then there's 2/5 on that side and 2/5 on that side of the face. Now, contrary to your belief, your right side of your face is not a mirror image of your left side. It's not a mirror image of the left side. Let's see, young man right there, what size shoe you wear?
9.5.
9.5. But when you put that size 9.5 shoe on, one foot feels better in that shoe than the other. Why? Because his 2 feet are not the same length, nor are they the same height. Your 2 ears, and mine big old Dumbo ears, I got big ones, I know. They're not the same size. Your eyes are not exactly the same. You notice that? They're not the same. They're not the same. So when you look at a patient, you have to look at the symmetry of that patient's face. They're not the same. So when we come to the oral cavity, let's talk about the borders of the oral cavity. The external border of the oral cavity we know as the lips. Some people call them soup coolers. Yeah, you know, when you get some soup, it's too hot. But there's a muscle of the lips. That muscle is called the orbicularis oris muscle. Oris means mouth. Orbicularis means round. So there's a muscle surrounding the eye. That one is the orbicularis oculi. So the muscles of the lips are versatile. They can roll like this. They can go to the side. They can do this. They can do a whole lot of things based upon what your desire for them to do. But there are parts that you need to know about. Right under the nose, you see a little trough. Right under the nose, coming from the base of the nose down to the lip. That little depression right there is called the philtrum. Everybody's got one. But the part of the lips that you use to put the lipstick on, that part of the lip is called the vermilion border. Vermilion means red. And we put lipstick on it. Some is black, some is green, some is pink, some is red, some is blue. Y'all put all kind of stuff on there. You know, I put me some on too. I like it. I like it. You know, I got me some lipstick too.
Yeah. Okay then.
Taste it.
He needs something with me.
Yep, that's right. That's.
Because you want those lips to be good and moist and juicy.
Right.
Huh? You want them. But you'll notice that the vermilion border is dry. The vermilion border of the lip is actually skin. It's actually skin. But everybody take your tongue and rub the inside of your lip. You feel how slickety that is? It's wet, isn't it? Because that is called mucous membrane. It's wet. And there is a junction between the skin and the mucous membrane. That junction is called the wet-dry line. Here is dry, inside is wet. The wet-dry line. Now, what you would call the corner of the mouth is called the commissures. The corners of the mouth. Now, as I'm going, if you have a question, blurt it out. Ask the question. So a beautiful smile.
Yeah.
Pretty. Yeah. You got it going on. You know, Hollywood smile. Yeah, it's nice. Very nice. And you can see those pearly whites. Real pretty. And I tell dental students, never ask a patient, what color teeth do you want? What's going to be the answer?
White.
And teeth are not white. They're not white. So when you talk about the color of a tooth, the color of a tooth is known as a shade. So instead of saying what is the color of the tooth, you say what shade. And shade has three components. It has the hue, the chroma, and the value. What we would call color is the hue of a tooth. The hue of all teeth is yellow. Teeth are yellow. Uh-oh, I better say that again. Teeth are yellow. That's the hue. But the chroma would say, how yellow? Not very yellow. That's why they look to your natural eye as being white, but they're not. Your eyes are fooling you. They're not white. They're actually yellow. So, if you look at this bag right here, what's the hue of this bag?
Red.
Red. But guess what? This, dang, that's a lot of whiskey in there. This is also red. Because you said it's pink, but pink is not a color. It is red with low chroma. In other words, it's light red. That's called the chroma. And then look at this one. It's got the same chroma and the same hue, but look at how shiny this is compared to that. This one has high value. So when you start looking at things, you're going to start taking into consideration the different component parts of what we would normally call color, because there are different components to it. Okay? So when we look into the oral cavity, everybody bites teeth together. Bite. Then put your lips together. Keep your teeth biting together. Then blow. There's a big space outside your teeth, right? Then on the other side of the teeth, there's another space. That's where the tongue is, right? So that space outside your teeth is called the vestibule. The space inside your teeth is called the oral cavity proper. Now, everybody get your models. Get your models, articulate them together. And the good thing about having a model of a patient's mouth is that in the real live patient, you can't see what's going on the inside. But on that model, pick it up and turn it around to the back and look inside. That space that you see in there is called the oral cavity proper. That's the oral cavity proper. So the mouth has two compartments. The compartment outside the teeth, but yet inside the lips and the cheeks, is called the vestibule. That compartment inside the teeth is called the what?
Oral cavity proper.
Oral cavity proper. I believe you got it. Are there any questions? So you'll notice up under the upper lip that there's a little flap of tissue right there above the upper lip. That little flap of tissue is a muscle known as a frenum. F-R-E-N-U-M. Everybody got one. And that frenum is a muscle that helps operate the lip. Okay? If you look over on the sides, there are some frenums over there. So this frenum is by the lips, and the Latin term for lips is labia. So that frenum by the lip is called the labial frenum. But everybody bite your teeth together, put your teeth, the lips together, and then blow. See that tissue out here on the side?
Mm-hmm.
There's a muscle right there. That muscle gets its name from buglers that blow horns. Those muscles are called bugler muscles, but more specifically, they're called the buccinator muscles. So there is a frenum on the side by your cheeks that's called the buccal frenum. There's one in the lower buccal frenum, the lower labial frenum. Are there any questions? Hello? Most people think the gums are pink, but we at Meharry proved that that is not the truth. In the literature, you'll see that the gums, which has a scientific term called gingiva, is not necessarily pink. So the literature was written for Caucasian men. They didn't consider women when they started coming up with these terms. The terms were coined based upon white men. And then they extrapolated those terms to include women. But they did not extrapolate those terms to include all races of people. There are people of color that don't have pink gums. They don't have pink gums. And you will see them darkened by melanin, just like the melanin in my skin. So in 1946, Dr. William H. Allen here at Meharry discovered or developed a plastic material to serve as artificial gums for patients when you make dentures. And when we go down through, have y'all seen the museum yet? Not yet. When we gonna go do that?
Later today.
Later today. You'll be able to see those developments that happened in 1946, where Dr. William H. Allen put melanin in denture acrylic so that they could make dentures to look like the teeth of peoples of color. Look at this. Black people can have any number of different colored gums. Any number of different colors. From black to brown to pink to any number. This is the oral cavity of a skull. The oral cavity of a skull. You got it? It's a lot of teeth around there, huh? So let's talk about the variety of teeth that you have. You got a model that has all of those teeth on it. They have varying types of teeth all the way around. Some are incisors, some are canines, they have premolars and molars. They have upper teeth and lower teeth. You got a model that shows that right there. Has everybody got it? Any questions? Okay, here we go. Here we go. So incisors get their name from scissors. In other words, what does an incisor do? It cuts. It cuts. You have canine. Canine, the tooth canine resembles the dog tooth. The canine. The canine resembles, I don't know why they didn't call it a feline tooth, because the cats got them too. Then you have premolars. So what I want you to do is on your cat, I want you to point to an incisor. Show it to your classmate. Show it to your neighbor.
Incisor right here.
Show them an incisor. And then show them there are two incisors. There's a central incisor and a lateral incisor. They're cut. Find the canine. Where's the canine? Can you see it?
It's not that short.
Then find the premolars. There are two on each side. And you'll find that the premolars are named premolars because they're positioned before the molars.
Oh, no.
Before the molars. Okay? So now let's go to the molars. The molars get their term from the word maul. To maul. To maul. In other words, those molars are the ones that get all the chewing done. They're the maulers. So there we have it. And you'll look in there at the very last tooth. Open up your, just pick one of them up. The up or all the way, don't matter. And go to the tooth farthest in the back. that is a third molar. That's also known by you and your family. Many of you don't have it yet. It's called a wisdom tooth. It comes in at age 18 to 24 years old. The wisdom tooth. They call it the wisdom tooth because at age 18, they consider you to be what? Grown. Wisdom, the age of wisdom. So they're the third molars. Most all of you have only second molars right about now. Don't worry, they're coming. So there are two sets of teeth. Two sets of teeth. You have primary teeth or deciduous teeth that many of us would call them baby teeth. The baby teeth. But all of you, most all of you, lost all your baby teeth and they were replaced by permanent or adult teeth. So you get two sets. Everybody with me? But you have three dentitions. You have a child that has a mouth that has only baby teeth. So that dentition is a primary dentition. And then you got older folks like yourselves that have all permanent teeth. So therefore your dentition is a permanent. But at age 6 years old, you got your first permanent teeth. And you also had baby teeth. So therefore, you had what is known as a mixed dentition. So the mixed dentition says you have both permanent and baby teeth. So like this young guy right here. Let's look at this young guy here. You can see a permanent tooth coming into place. This person is approximately 7 years old. But that's a baby tooth there. That's a baby tooth there. These two are permanent incisors. These are baby teeth here. So he has both permanent and baby teeth. So he has a mixed dentition. So there is a primary dentitional stage of life when you have only 20 teeth. Then there's a mixed dentition where you'll have 24 teeth and a permanent dentition that will have 32 teeth. Are there any questions? Oh, that's right. So how do you identify all of these teeth? Any and all discussions about the teeth is always related in regards to the patient, not to yourself, the operator. So in other words, what am I saying? I'm saying that when you look at a patient, the patient right side versus the patient's left side, not your right side and your left side, you're the doctor. So you're going to discuss things with regards to whom? The patient. So in other words, the patient's upper teeth and the patient's lower teeth. The patient's nose, not your nose, the patient's nose. The patient's mouth goes on and on and on. So let's look at it. The dental arches are two. You got a maxillary arch and a mandibular arch. So the maxilla is that bone right there. Therefore, any teeth attached to the maxilla are called maxillary teeth. So on your cast, show me the maxillary teeth. The maxillary teeth have inside it the palate. So look at the maxillary teeth at the inside. Look at that big palate sitting there. You can take your tongue and rub up the top of your mouth. That's the what? Palate. There are two palates. There's a hard and a soft. So the teeth associated with the maxilla are called what teeth? Maxillary. Therefore, the teeth associated with the mandibular. Yes, yes, sir.
So what happens when people have a cleft palate?
Oh man, that's a great question. Because the maxilla is made actually of two bones, a right maxilla and a left maxilla. As the child is developing in mama's womb, the skull is developing and the right side and left side fuse on each other. A cleft means that they didn't fuse and left a gap. That's what a cleft is. Can it be corrected? Yes, but it takes surgery to correct. Yes, it can be. So this is what I want you to get out of today. The dental nomenclature. Each tooth has a number known as the universal code. Each tooth has a number. Okay, I want you to take your maxillary cast and turn it up and look at the teeth. And remember, we're going to look at everything in relation to the patient, not you. The very last tooth on the upper right side, this one right here, is the last tooth on the arch. Everybody put your pencil on that tooth. Show that's right side. That's your right side, but where's the patient's right side? There you go. It's there. That is tooth number one. Tooth number one is the permanent maxillary right third molar or wisdom tooth. Is number one. Number two, put your pencil on number two. That's a maxillary right second molar. Three, a first molar. Second premolar, first premolar. Canine, lateral incisor, central incisor. So tooth number 8 is the permanent maxillary right central incisor. Number 9 is the maxillary left central incisor. Yes, ma'am.
So for primary dentition, would number one be the second premolar?
No. Good analogy, but no, that's actually not the truth. That is not the truth.
Good question.
Great question. In the primary dentition, there are no premolars.
Oh,
Okay.
In a half of a mouth, this is the primary dentition. That's called the dental formula. In other words, in a half of a mouth, if you're looking at me and I'm the patient, this would be the left half. So here I would have two centrals. Then I'd have one canine, 1, 2 first and second molars. All day long, every day. But in the permanent dentition, and this is what dental students a lot of times get confused on. The baby incisors are going to be replaced by the permanent incisors. The baby canine is going to be replaced by the permanent canine. The baby molars are going to be replaced by permanent premolar. And then The permanent molars don't replace any baby teeth. Don't replace any at all. And so no. And when you number baby teeth, instead of using numbers, you use alphabets. So the first baby tooth would be tooth number A. Oh, you hear me? I didn't say tooth letter A. What did I say?
Number.
You say, but A is an alphabet, it's not a number. Well, it is to us. Us dentists noted that tooth is number A. So it's A through E, F, G, all the way around. Okay? And that lets you distinguish a permanent tooth from a baby tooth in the number. So now, as you count, where's my time? Oh, I'm just about okay. I'm hurried. I'm right. All the way around to the maxillary left third molar, which is tooth number 16. Find tooth number 16 on your upper calf. It's the last tooth on the left side. That is the permanent maxillary left third molar wisdom tooth. But you got 4 wisdom teeth. Wisdom teeth. Then you drop down on the left side to the lower. That first one right there is number 17. 18, 19, 22, all the way around to 32. So 32 is the permanent mandibular right third molar or wisdom tooth. Now you can talk to any dentist anywhere in the world and all of them know tooth number 6. They all know tooth number 14. They all know tooth number 32, tooth number 30. They know which teeth those are. So now you can count them. Now, when you go to your dentist and they start talking to you about something of dealing with your teeth, you can understand what they're talking about, which tooth they're talking about. So here we go. Same thing, the universal code. And we describe these teeth based on traits. There are traits of teeth. Who you look like in your family? You look like your mom. So that means you have features like mom, right? Who you look like? Mom. That means you have characteristics like mom. So each tooth has its own distinguishing characteristic. Anybody ever heard of a term called grace? Grace? Matter of fact, some of you may even have a name called Grace. Gracie. What is grace? Grace is unmerited favor. It's favor. That means you favor your mom. You favor your mom. Who you favor? My mom. Okay, who do you favor? My mom. Who do you favor?
My dad.
My dad. You have characteristics like what? Dad. These are called traits. And in the Bible, the term grace is charis. Charis. That you get the word character. You get the word characteristic. So you have characteristics like your mom. Characteristics like your mom, like your mom, like your mom, like your dad. Those characteristics mean that you have grace, character. A tooth has character. A canine has a characteristic. Can anybody tell me what a characteristic of a canine is? It's sharp. Yes. It's pointy. It looks like what it's called. It looks like a dog tooth, doesn't it? That's its character. So when we talk about the anatomy of a tooth, we talk about the traits of a tooth, which are its characteristics. So there are 4 traits. You have set traits. Those are the traits that baby teeth have that permanent teeth don't. Set traits are the traits that permanent teeth have that baby teeth don't. You have arch traits. An arch trait. If you look at your cast, the upper teeth don't look like the lower teeth. You got 2 arches. They don't look like each other, right? Hello?
Yeah.
Then you have class traits. The class traits are the functional categories, like we said, incisors, canines, premolars, and molars. And then the last trait is a type trait. A type trait distinguishes one tooth from another tooth. So we can describe what the teeth look like. That is the type trait. In other words, you got a central incisor and a lateral incisor, right? Are they alike? They're both incisors, but they don't look alike. You got a first premolar and a second premolar. They're both premolars, but they don't look alike. That's what type of premolar. I got a first premolar, or I got a second. You have first, second, and third molars. They all have different characteristics, okay? Here we go. The big thing I want you to know today is the tooth tissue. Somebody said a tooth is an organ. It is. It's made up of several tissues. The hardest tissue in the human body is enamel. That is the covering of the tooth. Enamel is far harder than bone. I know some people that chew bones. Just crunch them up. Your enamel is harder than bone. Then you have dentin, and you have cementum, and you have pulp. So the hard tissues of the tooth are the dentin, enamel, and cementum, and the soft tissue is the pulp. And so here's a tooth, just to show you the inside of that tooth. Let's look at it. The crown of the tooth is covered with the white stuff called enamel. Then yellow is dentin inside the enamel, and cementum surrounds the root. And inside the tooth, what you would call the nerve of the tooth, is actually the dental pulp of the tooth. That just has nerve in it. So, I get my time waving at me and stuff, should have got me started talking. I keep talking. But I want you to know this as you go. A good healthy tooth has no tooth decay. But this one shows that the tooth decay is penetrating through the enamel. And this one shows that it's penetrating through the enamel and got to the dentin. Because dentin is softer than enamel, the decay spreads at the dentinal enamel junction. And then this one shows that the decay got down into the pulp. And this patient is hurting all to be damned. They're hurting. When you get down to that pulp, that tooth is going to ache. So, how does it cause? It's caused by plaque build up on your teeth. That's why they tell you to brush after every meal. I know you can't do it because some people eating stuff now. Did you go brush your teeth after you ate breakfast this morning?
No.
No. But I'm going to tell you how you can do it. Here we go. So as you finish your meal, Always have some water with your meal. Always have plain water with your meal. Even if you're drinking coffee or something else, but have some water. And when you're finished eating and you're not going to eat anything else, you take a sip of water and swallow. Oh, you missed that. What did I just do? I just brushed my teeth. Watch it. And girl, I tell you, that was a good dinner that we had today. And I think we're gonna come back here some other time. That is called the swish and swallow technique of toothbrush. It's not as good as a brush, but it's better than nothing. So don't get in public and start gargling. Don't do that. But just as you're talking, finishing up your meal, your guests will think you're just washing your food down and you're actually just doing it. And swallow and keep talking. Don't make no big deal out of it. But in the meantime, what you have done is broken the food that is trapped on your teeth. Somebody got braces. Where you at? There you go. You got something too? See that? Food gets trapped in those, don't it? So swish and swallow and get that food out of there until you can get where you can get it out real good. That's my time. Are there any questions? They're gonna put me out.
Dr. Ty.
My pleasure.
You said wait for a minute.
First of all, he makes sense.
Hello, everyone on Zoom. We hope you enjoyed the lecture. And we will see you back tomorrow at 9:30 a.m. All right. Central Standard Time. Have a great one.